Hello and welcome to this special discussion on COVID 19. Today, we will talk about the sudden rise in COVID cases and whether you should be concerned. We will also focus on children, what precautions should we take, and how we can ensure their safety during this period. So, joining me today is Dr. Romul Tikku, Director Internal Medicine, Max Super Specialty Hospitals. Dr. Tikku, welcome to the show. So, my first question to you is why is there a sudden rise in COVID cases?
Well, see, it's become almost endemic now. There will be times when the cases will go up and there will be times when they'll go down. But in the last month or so, there's been a surge across Asia and even other parts of the world. So it started with Singapore, Thailand, Hong Kong, and now even in India, in the southern states,
Okay,
Maharashtra, and now Delhi, even Haryana, Gujarat, Karnataka are having a spike. See,
right,
this variant, if we talk about it, it belongs to the same Omicron family and its descendants. The variants which we're seeing right now, LF7 and B181, belong to the same family. And these are mild variants. As of now, the cases that we've seen in India, those are mild cases. And most of the patients get better. The symptoms are same: fever, cough, cold, sore
right,
throat. And on OPD basis, they get better. But some might need hospitalization. And now, the ones who are vulnerable,
okay,
the elderly, the ones with comorbidities, cancer patients, diabetic patients, heart disease patients, they are the ones we have to be careful about. And having said that, everyone should take precautions. And precautions are basically avoid crowded places when there's a surge in the numbers, like it's happening now. Wear a mask. Wear a mask, especially when you're in public transport, at the airports, healthcare settings. And again, washing hands, it's very important because that's how you
right.
spread it. And while coughing, sneezing, just cover your face. And the ones who are sick, the ones who have a flu like illness, they should be staying at home.
Okay.
They should not be going for work. They should not be spreading it all over. So they have to take rest. They have to immediately get in touch with their doctors who will tell them don't self medicate, don't take antibiotics. There's no specific medication for COVID or
Okay.
particularly this variant. So symptomatic treatment, but to prevent complications, just it's very important that you get in touch with a healthcare professional at the earliest who can tell you the do's and the don'ts and stay isolated, drink lots of water, symptomatic treatment.
Doctor, there were also news reports that over 300 people have died due to COVID in the USA in the past week. So I wanted to know if we in India should be worried about it. And also, COVID is now in its endemic stage. But is there any chance for it to return and stay for a longer period?
See, endemic means it will be there throughout the year. There'll be ups and downs, and there won't be a pandemic like situation that it is there, but it's like flu, like you have every year. So we will see a spike every now and then, but it's not going to lead to that kind of a situation where the healthcare settings will be overwhelmed and there'll be a need for oxygen and there will be need of ICU beds. I don't see such situation happening because this
Okay.
variant over a period of time has evolved this virus and the variants that we're seeing, most of them are causing mild illness. Coming back to your question about deaths happening in US. See, we have to get into the details of
I
those
see.
particular patients. I don't know about them, what their history is like. Did they have comorbidities? Were they high risk? What was their history like? So that's what we have to get into. But if we look at India and if we look at the cases here, the ones who are having serious illness are not many, and the ones who are actually getting hospitalized, or very few deaths which have happened,
Okay.
are basically due to some other illness. And it's not COVID which is causing it. So in India, whatever cases we've seen till now, majority, it's more
Okay.
than 1,000 cases. So we
I see.
don't see that kind of a situation where it's causing increasing complications like pneumonia, respiratory failure, death, increasing mortality, increasing hospitalization. See, as long as that's not happening, we don't really have to panic. Yes, we have to be on guard. Yes, we have to take all the precautions. We have to be vigilant. And increasing surveillance is what we need, genomic sequencing of all
Okay.
positive cases. Again, you don't have to test everyone. You have to test the ones who are having severe illness. The mild ones can be given symptomatic treatment. They could be asked to take rest at
I
home
see.
and report to the medical professionals as and when needed. So I
I
would
see.
say the situation isn't bad as of now.
Okay, doctor. So now let's talk about the kids. Well, what symptoms should we as parents watch out for, and how should schools handle COVID precaution now?
See, if we talk about Delhi, the schools are closed because of the summer holidays. But when it comes to children, we have to be very cautious. See, there is no need otherwise to close schools. The numbers aren't that high, and whatever data we have, it doesn't support closure of schools. So, but having said that, we have to take care of children. They are more vulnerable to complications of COVID. So it's the same precautions for them. Avoid crowded places. Handle them after washing your hands. Make sure they don't go to those kid parties where someone else is sick or someone is having a flu-like illness. Those play dates that they usually have, and make sure they eat well, they eat healthy, and the ones who have health issues, they are taken care of. The ones who have asthma or lung issues, allergies, they should take their
Right.
vaccine. They should otherwise take care of their immunity. Nothing in particular about them, but yes, they're vulnerable,
Okay.
so we need to take care of them.
Okay, so what about the pregnant women and senior citizens? What precautions should they take?
Well, elderly again, the chances of them
Okay.
having comorbidities are more because of the age, and they're
Okay.
vulnerable and high risk for complications of COVID. So they
Right.
are someone we really have to take care of, some category, because um, the fact that they could be having these illnesses and they could end up with a pneumonia, they could end up with a complication or hospitalization. So they should stay indoors most of the time when there's a surge in the numbers. When they're stepping out or going to crowded places, they should wear a mask. They should maintain
Okay.
hand hygiene, and they should also take care of the comorbidities. If you're a diabetic, your diabetes should be under control. If you're a
Right.
hypertensive, your hypertension, your cardiac medications, everything should be taken care of. The
I see.
immunity factor is very important. Go for a walk, sleep well, eat well. And see, the good part is that majority of the population in India has either been vaccinated or has actually had the COVID infection in the past. So we do have good amount of immunity to protect us.
Okay.
But again, because these are new variants, because mutation has happened, it doesn't really guarantee that you won't get infected. You will still get infected, but the chances of you
I
getting
see.
severe disease complications and which requires hospitalization is much lesser.
Okay, I think we can sum it up like this. I think you need to be watchful. In case you show any symptoms, you need to go and get it checked. Otherwise, just take precautions.
Yeah, yeah, yeah.
Right?
Just be in touch with the doctors. As soon as you have a flu-like illness, don't self-medicate. Just report to your doctor. He'll decide whether you need the test, whether you need any particular medication, whether you need a nebulizer, inhaler. Don't take steroids or antibiotics on your own. Let the doctors only decide when it's needed.
Okay. Okay. So, viewers, that wraps up our discussion on COVID 19. Stay informed, take precaution, and look out for one another. Well, thank you for watching. Stay safe. Dr. Tiku, thank you for joining us.
Thank you. Thank you for having me.